Okay, guys, I have discussion F for you. This is the last one for the night. Okay, we're gonna get into it now. The article discusses a concerning trend in the United States. While people are living longer, the number of years spent in good health is not increasing at the same rate. Researchers at the Mayo Clinic analyzed global health data and found that between 2000 and 2019, life, life expectancy in the US increased slightly, but the number of healthy years added to life remained straightened or grew at a much slower pace. For example, American women saw their life uh, expectancy raised to 80.7 years, but the last 12.4 years of their life on average were impacted by disease or disability. The gap between lifespan and health span, the years lived in good health, is 29% higher in the US than the global average age. This means that while longevity is improving, the quality of life or quality of extra years is not keeping up, leading to more years burdened by illness. Public health experts argue that this growing gap has serious implications for healthcare policies and the well-being of aging populations. The findings highlight the need for better strategies to improve health adjusted life expectancy rather than just increasing lifespan. Lifespan refers to total number of years a person lives, while health span is the number of years is the number of those years spent in good health without major disease or disabilities. The concern highlighted in the article is that while people in the US are living longer, their health span isn't keeping up with pace. This means that many spend their later years dealing with chronic illnesses rather than enjoying a prolonged period of good health. This growing gap between lifespan and health span suggests that healthcare improvements should focus not just on extending life, but on improving the quality of those extra years. Okay, it's not just about more years, it's about better years. The US has a wider health gap at the end of life than any other country, meaning that while Americans are living longer, they are spending more years burdened by disease or disability compared to people in other countries or other nations. Globally, between 2000 and 2019, the expectancy increased by 65 years, but health adjusted life expectancy only grew by 5.4 years in the US. The gap is even more pronounced. American men gained 2.2 years. In life expectancy. But only 0.6 years in health years, while American women saw no improvement in their health adjusted life expectancy. Life, despite living longer compared to other high income countries, the US consistently ranks lower in long term health outcomes, including the expectancy and chronic disease management. Studies saw that despite spending nearly twice as much per capita on healthcare as similar wealthy nations, the US has worse health outcomes. The widening gap between lifespan and health span in the US highlights the need for better healthcare policies that focus not just on extending life, but on improving the quality of those extra years. The US has a wider health gap at the end of life than other countries. Than many other high income countries. Meaning, Americans spend more years burdened by disease or disability compared to their peers. Compared to countries like Australia, Canada, France, Germany, and the United Kingdom, the US consistently ranks lower in long-term health outcomes, including the expectancy, and chronic disease management, despite spending nearly twice as much per capita on healthcare as similar wealthy nations. The US has worse health outcomes. For example, Australia ranks among the top nations for healthcare efficiency and health outcomes, with a higher health adjusted life expectancy than the US. Canada has a lower rate of chronic disease burden and a higher percentage of years lived in good health compared to the US. Germany and France have stronger preventative care systems, leading to better health spans over outcomes than the US. The United Kingdom has universal health care coverage, which contributes to better health adjusted life expectancy. The widening gap between lifespan and health span in the US highlights the need for better healthcare policies that focus not just on extending life, but on improving the quality of those extra years. Certainly, here are some case studies on health outcomes in Australia, Canada, France, Germany, and the UK, based on comprehensive health systems analysis. Australia consistently ranks among the top nations for healthcare efficiency. A study by the Commonwealth Fund found that Australia has one of the highest health adjusted life expectancies among developed nations, largely due to its strong primary care system and universal health care coverage. Canada's single player health care system ensures broad access to medical services, but challenges remain in wait times for specialty care. Studies show that Canada outperforms the US in chronic disease management. with lower rates of diabetes related complications and the cardiovascular disease. France's healthcare system is ranked among the best globally with universal coverage and strong preventative care. A case study on cancer treatment outcomes found that France has higher survival rates for breast and colorectal cancer compared to the US, attributed to early screening programs and accessible treatments. Germany dual public private healthcare system provides comprehensive coverage, leading to higher, better long-term care health outcomes. A study comparing diabetes management found that Germany has lower rates of diabetes-related amputations due to protective monitoring and early interventions. United Kingdom, the UK National Health Service, or NHS, ensures universal access to care, but faces challenges in funding and resources allowances. A case study on cardiovascular disease prevention found that the UK has a lower rate of heart disease mortality compared to the US lately due to public health and initiatives targeting smoking and obesity. These case studies highlight how different healthcare models impact health outcomes. Would you like more details on a specific country or condition? Let me know. Okay, folks, so that is it for tonight. I will see everybody tomorrow for shows. Until then, Gator Wellness, take care, folks.